Ovarian cysts are very common. I often observe widespread confusion about ovarian cysts in our practice, making it challenging for patients to choose the right treatment. Sometimes people keep on taking tablets where surgery is needed. On the other hand, some women go for surgery where tablets can solve the problem. Here, I share several pointers based on which patients can take their decision in consultation with their own doctor. This helpful information comes directly from the science. Even though it is not a replacement for personalized doctor's prescription, but it can give you a solid understanding of the scientific basis about how doctors think. Question 1. Do I really need a surgery? Majority of small, simple ovarian cysts disappear spontaneously. Therefore, before the surgery, surgeons double check if you need surgery at all. How do they know that? Here are some tips from the scientific world. Ovarian cysts are divided into two broad categories: simple ovarian cyst and complex ovarian cysts. An ovarian cyst is a fluid-filled sac that forms in the ovary. Simple ovarian cysts contain only liquid, while complex ovarian cysts may have compartments, solid areas, or multiple cysts within them. Understanding the difference is important because simple cysts, especially those 3 to 4 centimeters in diameter, often disappear on their own within 2 to 3 months. These cysts can form due to ovulation and typically resolve if we give ovaries some rest. Follow-up ultrasounds are recommended to confirm their disappearance. Larger cysts, particularly those over 5 to 6 centimeters, are more likely to persist and may require surgery to prevent future complications. Cysts between 4 to 6 centimeters need regular monitoring through ultrasound scan to track any changes. Ovarian cysts are notorious to stay under radar. They can hide for a long time without any symptoms. A silent ovarian cyst does not mean that you do not need any treatment. In the medical field, the ovary has earned a very bad reputation. Even when faced with ovarian cancer, patients may be unaware of the symptoms that they are developing. Therefore, relying solely on symptoms can be misleading. For complex cysts and in cysts, especially in women over 50, specific blood tests are essential to assess the risk of cancer. Timely interventions is crucial to avoid delays in treatment. It is vital to distinguish between simple and complex cysts accurately. For more detailed information, a special booklet is available on request. Question 2. Can I save the ovary and just remove the cyst? Many ask this question. There are two ovaries in the woman's body, one on the right and another on the left side. You need to ask your doctor directly that keeping the cyst side ovary is safe or not for the future. Sometimes, even if you have got one cyst in one ovary, both ovaries stick together just like a gum. This is also known as adhesion. Anyway, if there are no complications within that cyst, then just removal of the cyst will be enough. And you will have the liberty of keeping the same side ovary if it is not affected. However, in some cases, the cysts are so big that it has already engulfed the same side ovary quite fully. In this situation, keeping the ovary means to keep a part of the cyst which has got a tendency to develop into further cyst or problems in future. Therefore, sound preoperative planning is always needed to check if there is any healthy ovary remaining within the body. However, the final decision has to be taken on the day of the surgery as the surgeon sees and checks the ovaries in naked eyes. Scans cannot always say that ovary is healthy or not. As a surgeon, we see frequent discrepancies between the scan report and surgical vision. We must understand that the scan has to be safe for human body. So, in order to be safe for the human body, the accuracy of the scan has to be dialed down, and discrepancy of the scan report does not mean that the radiologist who did the scan did not report it well. It is an internationally recognized problem. However, special scans like MRI scan are often done before the surgery when in need better understanding before the surgery about the uterus and ovaries, so the surgeon can plan the surgery better. Question number 3. What about recovery after cyst surgery? Most cyst surgeries today are performed using laparoscopy, also known as keyhole surgery, which allows for faster recovery. Patients typically return home within 2 to 4 days, but individual recovery time can vary. Pain relief medications that require hospital administration are gradually reduced before discharge. Most patients start walking on the day after surgery, with physiotherapy support, of course. For non-strenuous jobs, patients might return to work in about 2 weeks, but those with strenuous job or long commutes may need additional rest. Post-surgery, menstrual cycles may be irregular for 2 to 3 months, but this is usually not a major problem. It is crucial to complete all the prescribed medications and avoid constipation. Driving can typically resume around 4 weeks post-surgery if the procedure was uncomplicated. Adequate protein and vitamin C intake is essential for tissue healing, as they help develop collagen. Rehabilitation or preparing before the surgery can enhance recovery. For larger cysts or open surgeries, recovery might involve more pain management, but modern techniques aim to minimize discomfort. Patients usually start walking on the day after open surgery and can expect to go home within 4 to 7 days. Returning to work may take up to 2 to 4 weeks, and heavy lifting should be avoided for up to 3 months. Whenever safe, laparoscopy is preferred due to its quicker recovery time. Next question, number 4. Whether the surgery should be open or laparoscopy. As I have mentioned previously, the majority of the cyst surgeries are typically performed using laparoscopy. However, there are situations where doctors may opt for open surgery due to potential long-term harm associated with laparoscopy or robotic procedure. Let's delve into the nuances. Choosing open surgery. Despite the initial intention to perform laparoscopy, there are cases where patients cannot tolerate it well once the anesthesia kicks in. Some individuals have particular sensitivity towards abdominal nerves, leading to significant fluctuations in their blood pressure and pulse rate during laparoscopy or robotic surgery. In such instances, the surgical team may decide to convert to an open surgery in the operating theatre. It is impossible to predict which patient will react this way. Therefore, flexibility is crucial in surgical decision making. The challenge of small incisions, you must also know about this. Laparoscopy involves making small incisions, usually around 5 mm incisions, through which specialized instruments can enter the body. Now imagine a scenario. You have a cyst that is 6 cm in diameter, and it needs to be removed through that tiny 5 mm incision. What does the surgeon do? Well, the cyst is carefully cut to fit the small opening. For straightforward cysts, this approach usually poses no problems. However, with complex cysts, removing tissue in this shredded manner can potentially spread the disease. Cancer consideration, very important. If the cyst is cancerous, the situation becomes even more critical. Taking out tissues in small pieces during laparoscopy may have implications for patients' future health. It's essential to have candid conversation with your doctor before surgery. Discuss the likelihood of encountering issues within the cyst. It is essential to have a candid conversation with your doctor before surgery. Discuss the likelihood of encountering issues within the cyst. Your doctor will provide detailed explanation and address any concerns. Keep in mind that current medical science does not allow doctors to definitively determine whether the cyst is cancerous solely based on ultrasound, MRI or blood test. A conclusive diagnosis often requires further evaluation. If cancer is present within the cyst, it will be diagnosed through the biopsy report, which typically takes about 10 to 14 days time to get completed. Therefore, doctors rely on ultrasound, MRI and certain blood tests to assess the risk of the cyst being cancerous. Ultimately, the decision to perform surgery is often based on visual assessment of the cyst. As an informed patient, it is crucial to ask your doctor about the likelihood of the cyst being cancerous so you are not taken by surprise by the diagnosis after the surgery. If cyst is complex, the chance of it being cancerous are higher than a simple cyst. Therefore, careful consideration is needed when deciding whether the surgery should be performed laparoscopically or as open procedure. With the rapid advancement of the science, there are precautions that can be taken even during laparoscopy or robotic surgery. Oncological surgeons can take specific measures to ensure that parts of the cysts do not spread within the abdomen when it is removed through that small incision. Question number 5. Could cancer be hiding inside that cyst? As many patients ask this question, I have separate blog post and video specifically on this topic. You will find those links in the description box below. However, before surgery, it is essential for you as an informed patient to have an open and honest discussion with your doctor about the likelihood of the finding problem within the cyst. Most ovarian cysts are benign or non-cancerous, leading many to believe that a cyst automatically means it is not cancer. This is a misconception. Proceeding with the surgery without understanding the risk of cancer can be harmful in the long run. The world is changing rapidly, so is the nature of various diseases. If a cyst surgery is performed under the assumption that it is a normal non-cancerous cyst, the patient may require a second surgery to complete the initial procedure. Therefore, it is crucial for both the patient and the doctor to take adequate precautions before the initial surgery. You may find valuable clues in your ultrasound scan report. If it indicates a simple cyst, the chance of finding cancer are very low. However, if the ultrasound scan mentions complex cyst, the likelihood of hidden cancer is higher. Look for specific terms in the ultrasound scan report that may indicate a higher risk of cancer in a complex cyst. These are some of the terms. If these are written on ultrasound report, your cyst is a complex cyst, such as septum, multiseptate, multilocular, solid area, papillary projection, heterogeneous, irregular cyst, increased blood flow, etc. If you are unsure, you can always ask your doctor for clarification. If your ultrasound report mentions these items, based on 2018 ORAD system, your cyst will be classified as high risk. I hope you recover swiftly from your surgery. Please let us know if our video research has been helpful in your recovery. See you soon. That's all for today.